Our next presenter is Dr. Brittany Busse. She is the president and co-founder of CMO of ViTel Health, a next-generation digital health platform that empowers providers to build the ideal health care practice. Welcome, Brittany.
Hi, guys. Please excuse my 2-year-old who may be talking a lot in the background because he's
No
just
problem.
with me today. We had some illnesses running through our family, and now the nanny's got it. So we are here, though. And let me go ahead and share. Oops, I did share, and then I unshared. Sorry about that.
Yeah, an entrepreneur in the making.
Yeah, exactly. He always asks, is mama a doctor? Because he watches a show and they talk about doctors, and my partner says, oh, mommy's a doctor. And he goes, she is? Great. Thank you so much, everyone, for joining tonight and for hearing more about ViTel Health. As you mentioned, I am the president and co-founder, as well as the chief medical officer of ViTel Health. We are revolutionizing solutions for independent care and transforming our sick care system into a healthcare system. So I want to talk today about our current raise, which is focusing really on our what I call tech-enabled healthcare coaching solution. Some other people might call it remote monitoring and chronic care management, but I feel like our program takes that a step further to really focus in on those modifiable lifestyle-based behaviors that can really make a difference in the lives of patients. So as you may be familiar with, if any of you here are doctors or working in the healthcare system, you know that we have a huge sick care problem in the United States. At least 80% of people have at least one chronic condition, 68% have 2 or more, and these very common conditions are actually mainly attributable to modifiable lifestyle factors. So these 8 risky behaviors are actually driving these top 15 chronic conditions, which is leading to most of the spending in healthcare in the United States today. We also know that our spending is out of control in the United States. We are spending more and more money on expensive interventional care while our life expectancy continues to decline. So other countries are spending more money on preventative care and primary care and experiencing better quality and quantity of life than we are here in the United States. So at ViTel Health, we think that should change, and we want to bring more awareness to preventative care by really enabling frontline primary care providers to provide a specialized level of care and also to boost their revenue. So we know that primary care doctors often suffer and end up having to sell to private equity or to sell to large healthcare organizations because they can't find a financially stable way to stay in business. So we want to empower those doctors with better data, real-time monitoring for their patients' health conditions, better relationships between the doctor, a health coach, and the patient, really bringing back that personalized approach to medicine that so many people often grew up with, especially those in this baby boomer generation who are now in our Medicare population. They were used to that one-on-one relationship with their doctor, and they have lost that. And we're bringing that back by enhancing their care with these one-on-one health coach relationships that connect them directly back to their health and back to their doctor. And what we're seeing is better outcomes for our patients in terms of better quality of life and reduced burden of disease and reduced burden of medications. So our equipment is extremely simple for these patients to use. They just take the cellular hub, plug it in their home, and it just works. They just use the equipment exactly like they would any other piece of equipment. Step on the scale, use the glucometer, use the blood pressure cuff, and it all just takes the readings and automatically uploads it back to our system. No apps to download, no Bluetooth connectivity. Everything is set and ready to go when they take it out of the box. They just have to put batteries in it. But above and beyond the ease of use of our equipment is the personalization and the compassion that's shown by our team of healthcare coaches. They are the patient's trusted partner for better chronic disease management. In fact, even their family members find that having the health coach to talk to improves their experience of having an older parent with chronic diseases. They know that the vital signs are being monitored. They know someone's looking out for their parent, and they feel a lot more comfortable with the care that these parents receive in these care homes or memory care facilities for those with dementia. We definitely have better health with less medications. Many of our patients are being deprescribed, something that doctors don't always feel comfortable with. But given the fact that we're consistently monitoring their remote data, the doctors can see the changes in blood pressure or the changes in blood sugar trending down and can feel comfortable removing medications and then watching the result. So we know we can always go back on if we need to, but just having that comfort level allows the doctors to deprescribe with ease. Our patients are thrilled. I mean, I collect positive feedback all the time because I love giving it back to the doctors. The patients really feel like someone in the healthcare system finally sees them, that they have someone they can rely on to explain complicated issues to them, that somebody is really looking out with that for them and giving them accountability and helping them truly engage in their health again. So how many of us are so disengaged from our health? Like, if you look at all of the things we were told to do to be healthy, it's frankly overwhelming. When we have a health coach in our corner giving us those SMART goals, right? Those simple, measurable, attainable goals that they can really achieve, they start to feel good about themselves and their ability to manage their health again. Unlike other companies, we really pride ourselves on the ability to not just get the patients into the program, but keep them in the program. So we are really concerned with monitoring, with learning from our patients, finding out what works in our marketing strategies, not just our external marketing to the doctor's office, but also what we call the internal marketing, which is marketing the solution to the patients after we've signed up a doctor's office. So we like to define those goals really clearly, get an achievable number and something that's replicable so that we know where we're headed and can plan for the future. The VA has shown that remote monitoring can actually reduce hospital admissions and bed days. So it's really awesome for anyone who has a value-based care arrangement through Medicare Advantage to utilize this system, because that can actually increase their payments in the capitated model. So our goal is to translate the $4.1 trillion on chronic care management spending into disease prevention. And our team is highly, dedicated. My partner is a medical technologist and technologist by background, a successful entrepreneur with several exits. We have Harvey, who is really interested in the AI portion of this, like how do we use AI to improve the outcomes and to, really look at the data that we're getting. We have our operations and VP and marketing all working together to make sure that we can be successful. It's a huge market, right? Even if we just look at Medicare beneficiaries alone, which we know we can actually expand this to specialties and other areas. But just if we focus on that one segment of 65 million Medicare beneficiaries, if we can even capture very small percentage, like 10% of that population, we could be a $6 billion company. We really focus on our traction and a controlled rollout. So right now our focus is onboarding really simply 2 doctors a month and 300 patients per month. It doesn't seem like a huge number. It's very reasonable, very attainable, and that will easily get us to this 5.4 million in recurring revenue by the end of the year, at which point we'll be looking to raise a Series A at around a $35 to $50 million valuation. So where we are right now is we are looking for investors who are interested in receiving a safe note in exchange for their investment. Minimum investments $50K. We were originally looking to raise about 1.5 million. Right now we're doing really good in terms of revenue, so we're not sure we need to raise that much, but we're happy to have anyone participate if they're interested. And I'll take any questions as soon as I just check the stove back here real quick since I'm cooking dinner. Mom, it's okay, baby. Mommy's just gonna check the stove.
Thank you, Dr. Busse. That's great. Well, we have a real world physician here working 4 jobs. Thank you.
A little bit of everything.
Okay. Go ahead and stop sharing, and time for questions. Anybody have questions? for Dr. Busse?
Right here.
Okay. All right. Margaret Wong has a question. Go ahead, unmute yourself and ask.
Hey, Dr. Brittany, nice presentation. I think it's about time that we, the healthcare should be more advanced than just going into the office all the time. So I have a question about your competitors. I mean, there are, I see you have a combination of good integrated solution with this, because there are teledocs out there. There are quite a few other players. So I just want to hear, what's your secret sauce, and how do you compete between now and in the future?
Sure. For us, the secret sauce, I think, is really just understanding the challenges that physicians would face implementing a program like this. So many of our competitors focus solely on either a platform solution or something that the doctors essentially have to run themselves. So they look at that and they say, okay, I have to hire more staff. That means 10 times more administrative work for me to do. The documentation alone will bury them about 30 patients into the program. So our solution is actually a turnkey solution. All the doctor has to do is notify us which patients they would like to have onboarded, and we take care of everything else. We take care of compliance with Medicare. We take care of all the documentation, the ordering, the staffing, and the billing, and we just cut the profits with them 60-40.
Oh, wow.
Yeah, so it's really a passive income source for these physician offices that makes them, like I said, a lot more financially soluble.
Yeah, absolutely. So how would you scale? Because you're taking the burden of them, but then it will become a burden for your company. So how do you go about scaling that?
Yeah, if you look at a lot of these models, so for instance, like Lark Health, or I'm trying to think of them off the top of my head right now, and I don't know why I'm totally like Noom. Let's say Noom is a big one, right? They have really focused on this model where they employ health coaches. So coaches are a really awesome resource, and they really don't cost that much salary wise. Like, they're highly trained, they're very personable, they're actually great salespeople because they're used to working for themselves. And so we're able to hire a very large volume of coaches at a very low percentage of our revenue. So that really makes the solution scalable. And the other great thing about coaches is it's about a 6 to 8 week training turnover time if you're going to get them certified for, like, let's say we brought in a medical assistant or a nurse or something like that, and they said, I want to be a health coach. It takes about 6 weeks to get them trained up on a certified program. So you can actually scale up fairly quickly.
I see. Great.
Mhm.
Well, thank you.
Yeah, thanks.
Thank you very much. Any other questions, Dr. Busse? Ravi,
So,
go ahead.
Dr. Busse, I mean, what I'm trying to understand is how do the doctors involved? I mean, like, they just cannot turn around the patient towards somebody and then not be having the ability to know where they are. And what kind of a program do you implement, and how do you track them? And you're talking about removing patients of medications, and what is your secret sauce, or what is the way in which you do it?
Yeah, sure. So for us, our doctors are in constant communication with our health coaching team. Like, the coaches are not prescribing medications, right? That is the doctors 100%. We have a very easy to use, easy to navigate proprietary platform that the doctors can log into at any time and get an overview of their patients. They can look at all the alerts for those patients, but the coaches will also communicate to them if there is an alert value, like say a patient has a 180/100 blood pressure, they're going to reach out to the doctor and they're going to tell them. Onboarding process is really straightforward. You come to us as a doctor, you say, I want to be involved in the program. We'll get some paperwork signed and out of the way. We'll match your clinic initially with one health coach, depending on the size of the clinic, and then kind of grow your panel from there as you go. The coaches, typically how we do it is when a patient is seen in the clinic, they get a piece of marketing material that's provided by ViTel Health. So we give those to you, several hundred flyers for your clinic. They hand those out to the patients. They then get an outbound call from us within 2 days of that appointment. And they say, hello, you talked to your doctor about ViTel Health. This is us. We're going to send some equipment. We drop ship it straight to their door. There is no charge to the patient and there's no charge to the physician's office for any of this. So all the money from it comes from the billing. There is no upfront cost. And then the patients will be onboarded. The order will be written in the EMR. And from there, we have that ongoing relationship with the patients. And every month, in the first week of the month, our coaches will download a summary sheet from our proprietary platform and actually upload that into the doctor's EMR. So there's never a time when the doctors are not aware of what's going on with their patients. They know what all the care plans are, and they know what progress their patients are making at all times.
So are they able to track like on a platform? Do they have ability to track and see on a continuous basis the sugar is that, the blood pressure is that?
Yep, they can see everything that the patient is monitoring in real time.
Excellent.
Okay.
Thank you very much, Brittany, Dr. Busse.
Thanks. Thanks for having me.
And anybody